Hi Heidi, thank you for taking some time to speak with us today.
Sure.
Tell me a little bit about the kind of abdominal pain you were having when you first came to see me.
Well, it was pretty relentless, and it had developed into a chronic pain, and I was doubled over and trying to push on it to try to get some relief, and I really couldn't do anything to sort of self-soothe it. And I'd been to a number of different doctors, and nobody really had any idea what might be wrong. And people weren't even able to speculate at that point what it might be. So when I came to you, I was pretty much at the end of my rope.
Okay, and you had endoscopies and CAT scans and all sorts of things, right?
Yes.
And so we did some nerve blocks. And
right.
What were your results with the nerve blocks?
Well,
sorry, go ahead. So we did the nerve blocks.
Right. You did a nerve block on me the first time I came to see you, and at that point the pain was really interfering with even my ability to carry on with my day. And the nerve and I remember it was between 4 to 6 hours. The pain subsided, and you told me that if the nerve block worked, then your preliminary diagnosis that there might be some kind of nerve damage was probably accurate.
Right. Okay. And so then we did surgery on you, and we actually removed a couple little nerves.
Right.
And you're now, actually, what was your surgical experience like?
Well, the surgical experience was very good. I mean, it was...
Did you have a lot of pain post-op, for example?
Well, I did. I tend to, I'm a slow healer. I've had surgery before, and in fact, I'd had surgery prior to coming to you for something else in my abdominal area. I was a very slow healer.
So your post-surgical pain was complicated?
So I think my post-surgical pain was complicated by the fact that before I came to see you, the only real... medical prescription for me was painkillers. And so I was taking a probably significant volume of pain medication, and so post-surgical my efforts to then back off on the pain medication caused some complications. I was more dependent on that pain medication than I had understood before I had the surgery. So coming off the pain medication, I think, caused some of the pain. It sort of exacerbated some of the pain that I would have otherwise felt.
Right.
So I was able to come off those pain medications completely, and in the process of doing that, the pain from the surgery began to subside tremendously. And at some point, there was a little spike in pain. We did a steroidal injection around the site, and that then suddenly released all the pain that I was feeling, and that's been 4, 5, 6 months now.
So you're a little over 6 months now from surgery. Right. And you're off all your pain medicine.
I'm off all the pain medication, have been for over 4 months now. I am working out, full workout, basically 4 sessions a week for an hour. I play tennis, I hike. I was hiking in Yosemite last week for 4 days.
So it sounds like you're doing okay.
I'm regained full health, and frankly better health than I was before I came to see you.
So would you do the surgery again if you had to?
Yes, in a heartbeat.
All right. Thanks for taking the time.
Sure.
Appreciate it.